Joining us now is Senator Bill Cassidy, a resolution co-sponsor. He's also a retired medical doctor. And good morning, doctor. And I'll tell you what occurs to me about this whole debate and why it's so difficult and why both sides feel so strongly. Once we figured out that not all people respond to the vaccines, immunocompromised people, you can't vaccinate them into health. You just, because their immune systems can't do it. So until we get a therapeutic, it doesn't matter. You know, you can't say, I've got the vaccine, it's my business. What they do is their business. You can't say that anymore because people that aren't vaccinated, it could make its way to someone who did what they were supposed to do, were properly vaccinated, and they still get it. So it really is incumbent upon everyone to do this for those people that can't respond to it. Someone could die based on not being able to respond to the vaccine, right? So we need to get everyone done. We've done it before. Why not do it now? Mandate.
So
private company.
I'm a big believer in vaccination. I've heartily recommended vaccination from the get-go. But there's always a tension between personal liberty and public health. To what degree does the federal government institute a measure that takes away personal liberty? Now, state governments do it, local governments, school boards, we have a long history of that. The federal government, this would be brand new. Not because it's been discussed in Congress or has some kind of national discussion about it, but because the president does it by executive order. Reaching into private businesses. And by the way, kind of not cognizant of the impact. One example, I had an ambulance company call me. The ambulance company is publicly traded, does Medicare and Medicaid. He's competing, if you will, for employees against a municipal ambulance service. The municipal ambulance service is not under the mandate. So his employee can quit and go work for the municipal. The municipal does not bill Medicaid and Medicare. So therefore, the president's mandate does not cover it. This is the sort of thing that, you got to think about. And this executive order does not think about.
Until we get therapeutics, how would you try to help people that are called pandemic prisoners? What I think something that also threw us for a loop, doctor, was that fully vaccinated people can still kind of be carriers, even if you've had a booster. And therefore, whenever you get to the weakest link, someone's life is at risk. So it seems like we're not where we hoped we would be by this time because we don't have the therapeutics.
So, Joe, you just point out kind of the flaw in your initial argument. The vaccine does not necessarily prevent any infection whatsoever. It keeps you from serious illness. It keeps you from hospitalization. That is a good thing. But the idea that if we vaccinate everybody, there will be no infection, so therefore we all are kind of hunky-dory, is not true. Now, by the way, one thing that's also not been kind of emphasized enough, at least by CDC or acknowledged, is that people being infected previously gives a level of immunity. So there's different things that give immunity. There's different risks, even if you have some basis of immunity. But going back to my point, there's always a tension between personal liberty and public health. The president's vaccine mandate pushes the federal government in an area where it's never been done before, mandating on a federal level a vaccine, and without any other discussion except the president with his advisors. I actually think it should be more fulsome than that.
Senator, two questions. One is, while I recognize that clearly the vaccine unto itself may allow for breakthrough infections, clearly the science suggests that statistically your chances of getting infected are so materially lower than if you're unvaccinated. It's not even a close contest. So yes, breakthroughs are possible, but if you're trying to reduce the possibility, you do it by a material amount. In fact, something on the order of 90% for those who are boosted. So I think that's an important point in the sort of context of all this. The second thing, though, when it comes to personal liberty is, who said that you have the liberty to give me COVID?
You make a really good point, but may I point this out? We would save a lot of lives if everybody drove 35 miles an hour. If the federal government had a mandate, you're going to drive 35 miles an hour, and if you go above it, you're totally busted. In fact, we're going to put a governor on your car so that you cannot exceed 35 miles an hour. We would save a lot of lives.
Senator, we do have speed limits. We've got 55-mile-an-hour speed limits, 65-mile-an-hour speed limits, 35-mile-an-hour. I don't understand that line of questioning because we do have exactly what you just laid out.
No, I'm not saying have no speed limit. But when we had 55-mile-an-hour speed limits and people actually obeyed, people at some point stopped obeying, and they did 75. Now they do 80. So you're going to have more accidents with more personal liberty.
But
I'm not saying no speed limit. And when it comes to immunization, we have private businesses that are putting out mandates for the hospital employees to be vaccinated, for the school employees to be vaccinated. We've always done that on a local and a state level. On a business level, we've never had the federal government reach in to the private business and dictate that kind of, okay, in the tilt between personal liberty and public health, the federal government weighs in. That's my concern.
It's weird, Senator, that both sides use my body, my choice when they want to use it, and neither side listens to the other side when they use the same argument. Have you ever thought about that? It's weird.
I'm not actually going to accept that. By the way, again, I'm a big believer in immunization. I ran hepatitis B vaccine programs and flu vaccine programs in my practice. But I always had to respect the autonomy of the individual. Yeah. If the individual did not want to be vaccinated, I could not vaccinate her. That's actually the ethic that I kind of embrace. She is ultimately the decision maker as to whether she or her child or he gets vaccinated. And I think we have to be very careful before we step into that space. That is a kind of maxim of government. I mean, of medicine.
It's really staggering how strongly both sides feel about the issue, Doctor. Like so many things. And it's so hard to find middle ground. Anyway, we appreciate your time this morning, and it obviously helps that you're retired. I don't know. You used to be helping people, healing people, and then you go do this. Are you sure that was the right move?
You know, it's addressing healthcare by other means, and so but one's a meta and one's a micro.
You're right. Thank you for doing it. We appreciate it. Thanks.